So could you go and explain a bit more about a TENS unit?
Sure. So from like a physical therapy perspective, we use a TENS unit as a transcutaneous electrical nerve stimulation unit. Basically, I know you're wearing yours right now. Basically, we use it a lot in an outpatient setting. We use it for pain control. So patients, like if I were to put it on my patient, it goes on the skin, a couple electrodes that go on the skin. I know what. And we use for localized pain control. So like people with like low back pain, chronic pain, acute injuries, and basically it's sending nerve signals to your sensory system, and it kind of just numbs the pain and just overrides the pain sensation that someone feels. So people like literally will sit with it for, at home. You can even, some insurance cover it, people have it at home, they can sit on the couch with it, they put it on themselves, For really chronic, pain conditions, I've even worked with people that surgeons insert like literally the unit in their spine. So like this is a unit like that patients, like people use all the time.
Yeah, I've seen now they have them at Walgreens.
Yeah.
You go to Walgreens in the lower back pain section, they have miniaturized or small. I think
I've seen those too.
Yeah. So if you ever want to know what an e-collar feels like, you don't want to spend $300-$400, just go to Walgreens.
It's like
$30-$50.
I mean, going through physical therapy school, like we have, I guess really shocked each other. Like in therapy school, like we go from like the TENS unit, which is like for sensory and like pain control, which is mild. I know, but I'm busy right now.
He's like, when do I get to talk? Let me tell you about my experience.
Yeah, let me tell you about what I think about this thing, which I could talk about that later too. But it goes from pain control, like it's just a sensory feeling, to straight out like causing the muscle to contract, like a really weak muscle after nerve damage, and causing muscle contraction to the point of trying to strengthen a muscle. So like I've gone from using it on myself like for a little zing to straight out my hand is like convulsing in the air. I have it like turned up so strong, which can be therapeutic for patients if needed. But appropriate, for people.
Right, and it's I actually have a client currently that's a physical therapist, or I think she's studying to be, and she was telling me that they're feeling it themselves, and they actually did it to a point where her arm was like flinging back. Yeah. I guess to give them a concept.
Yeah, and we use it especially after like neurologic conditions. Like if people don't have function in their hands, you can literally use a unit, not a TENS unit, but a different electric unit to literally have someone lift their hand, pick up an object. Oh wow! And you use electrical conductivity to stimulate the hand to move and pick up objects. Wow! Via a unit. The patient, because there's no communication to the nerves to do it themselves. So like this is something that's widely used. For us. And
when you said that, it's because I'm a dog trainer, people. But the brain and the connection, that's like electrical, isn't it?
Yeah, it's it's your nerves, nerve conductivity. So it goes from the brain till your brain tells your hand, your leg, whatever to move. But it's all nerve communication.
Okay, excellent. So then, what's used for? So pros and cons of the TENS unit in regards to like with people.
Yeah, so with people, it's nice because you don't have to use there's no drug use, no drug people, especially chronic conditions, can have, drug or opioid or, dependence on medication for pain control. And this is an alternative form of pain control, because it's not going to fix the problem, it's just going to help with the pain. So it's one positive is that you don't use medication to control pain. It's easy to use. There's a few restrictions as far as when you wouldn't use it. So like patients that have pacemakers, skin sensitivities, or they don't have good sensation in areas, we wouldn't really be putting it on people. If they have like metal hardware, this isn't, I guess, reflect dogs, but this is more for people, that why you wouldn't want electrical conductivity going in that area. But yeah, the main use of it is for pain control, either acute, which means right after an injury, or chronic after having pain for a long time.
Okay.
I would say is the biggest